Good afternoon, everyone, and thank you for joining us for this virtual news conference. I'm Roxana Gapster, President and CEO of WellSpan Health, and I'm joined here today by Dr. Thomas McGann, Executive Vice President for Clinical Practice, and John Porter, Executive Vice President and Chief Operating Officer. A news conference held exclusively online is certainly a first for WellSpan, and it's symbolic of the many firsts we're experiencing as a health system, a community, and as a country. COVID-19, the disease caused by the new coronavirus, has disrupted more than our daily lives. It has challenged us to reimagine the way we deliver care for our community. During our media briefing today, Tom, John, and I will share an overview of the steps we are taking to prepare for this pandemic, how we're building capacity for the anticipated increase in positive COVID-19 patient cases we're likely to see in our community and hospitals, and how we're partnering across our region to ensure care for those who need it. Following our remarks, we will host a time for questions. WellSpan is leading in these uncertain times, taking swift and proactive action to help slow the spread of COVID-19 in our community and responding to the needs of our friends and neighbors. We were the first to offer not just open air testing sites, but a true network of sites across our entire service region. And this allowed us to collect samples and identify those at risk of infection early on. Now we're planning to double our critical care capacity in preparation for the expected rise in patients who may need care in our hospitals. Tom and John will provide more details on those developments in a few minutes. We're also proud to be collaborating with our community partners to help slow the spread and to support our care teams on the front lines. Our region has long been home to collaboration, innovation, and a commitment to our communities, reflecting our strong manufacturing roots and resilience. Our community and social services are coming together to help protect the health and safety of all those who live here. This spirit of unity and the acknowledgement that we're all in this together is a significant factor in our preparedness and response to the crisis. We're receiving offers of support from individuals and companies across our region. For example, local businesses who are partnering with us to develop new masks that have enhanced filtering capabilities and are made from lightweight materials. Local distilleries who are working with our pharmacists to produce a steady supply of alcohol-based sanitizer products, and local suppliers who are helping us replicate national innovations such as plexiglass shields and boxes to act as another layer of protection between patients and our staff during certain procedures. We've also received interest from more than 160 active or retired physicians, advanced practice clinicians, and nurses to help serve our community. We're continually evaluating how best to utilize their gracious offers to help, including answering questions on our coronavirus hotline, which is receiving more than 500 calls per day on our busiest days. This outpouring of support and partnership is evidence of our community's trust in WellSpan, and we don't take it for granted. A couple of weeks ago, we shared a video of our teams in action to show appreciation for all of their hard work. It has been viewed more than 100,000 times and shared widely on social media, reinforcing the power of our community. We're deeply grateful for this support and for the incredible partnership of all of our community leaders, local businesses, and elected officials in helping WellSpan prepare and respond to COVID-19. From the beginning of our response to this pandemic, we wanted to ensure access to care for every person in our communities. We knew we had to remove any potential barriers and make it as easy as possible for patients to be screened, tested, and treated, and to return to the community in good health. That's why we announced in early March that we would collect no out-of-pocket payments from our patients for COVID-19 specific testing or treatment. Though it wasn't mandated, we knew it was the right thing to do. We've also provided tablet devices to personal care homes and emergency shelters, offering free care through WellSpan Online Urgent Care and working together with government and social service agencies to ensure that our most vulnerable friends and neighbors can access the care they need. We're organizing efforts to collect and share donated food and supplies to community organizations who need them, and we're offering emergency grant funding to help support community partners in their efforts to slow the spread of COVID-19. This is our mission in action. working as one to improve health through exceptional care for all, lifelong wellness, and healthy communities. Together, we are living our values and pulling together to care for friends, neighbors, and our families. I'm so grateful for our team's dedication to each other and to our patients. I'm confident our collective strength and the innovation we're building today will get us through this and will serve WellSpan and our communities far beyond this pandemic. Now, I'd like to turn it over to Dr. Tom McGann, who will talk about the steps we've taken to manage the pandemic and slow the spread of disease in our communities.
Thank you, Roxana. First, let me say that I could not be more proud of our physicians, clinicians, nurses, and team members across WellSpan Health. This has been an exceptionally challenging time for our care teams, and they have truly risen to the challenge. We care deeply about our team and our patients. Their health and safety are foundational to our mission. To effectively manage this pandemic, we began operating a system incident command structure before our first case of COVID-19. This team is in regular communication with the CDC and the Pennsylvania Department of Health to ensure we are following the most current guidelines. To screen people for risk of infection and test those who exhibited symptoms, we developed our coronavirus assessment tool, an innovative web chatbot that provided community members an easy way to determine their risk of infection. More than 12,000 people have used this tool to date. And as Roxana mentioned, we quickly identified testing as a priority. We established early a network of approximately a dozen open-air COVID-19 testing sites across South Central Pennsylvania, including at our hospital campuses and community-based locations. We have completed more than 8,000 tests for COVID-19 since mid-March. Of the 7,000 or so results we've seen, only about 400 have been positive. The overwhelming majority of those patients are recovering at home, and a small percentage are being treated in our hospitals. Our early strategy to do widespread testing on those who were symptomatic and at risk for COVID has enabled us to slow the spread, as those 8,000 individuals were made aware of their risk and were told to self-isolate. But providing quick access to screening and testing was only the first step. We know that over time, many in our community will contract this disease. That's why we've redesigned 10 care locations across the region to exclusively treat the non-emergency needs of COVID patients, while protecting patients at our other care facilities from potential exposure. We work every day to reimagine healthcare, and COVID-19 is pushing that innovation to the forefront. We have significantly increased our use of technology and telemedicine to help slow the spread by keeping people at home, rather than requiring them to travel to one of our care locations for treatment. This includes our 24/7 WellSpan online urgent care service, as well as video visits, phone visits, and e-visits conducted by WellSpan providers across our medical practices. In the last 2 weeks of March, our providers conducted more than 4,000 video visits and e-visits across our entire footprint. And in addition, we've done 9,000 plus telephone visits. Today, more than 40% of our patient visits are occurring either online or over the phone. WellSpan Medical Group has also had 535 providers volunteer for redeployment, working in other places than they normally work. And just this morning, 132 started in training to be redeployed into somewhat different things than they're normally accustomed to doing. This is just a terrific testament to the desire of our providers to help their community. And we're one of the first health systems in the US to leverage a new online remote patient care tool through our Epic electronic health record, which powers my WellSpan. This tool, called Care Companion, allows patients who have tested positive for COVID-19 to communicate important information to our connected care team, all through a quick app-based questionnaire. We believe information and communication are key to slowing the spread of this disease. Our toll-free WellSpan Coronavirus Information Hotline is staffed by clinicians across our system. We've fielded more than 6,000 calls from community members since that hotline was launched just 3 weeks ago. We've also developed an online information resource for patients, medical professionals, employers, and community members, which has had nearly 200,000 unique visitors since it launched in early March. WellSpan believes strongly in caring for the whole person, including their physical, mental, and emotional well-being. And we know that this pandemic is not just a physical health concern. It's causing significant stress and anxiety among our friends and neighbors. We've established behavioral health resources, both online and through a toll-free hotline, to help community members take care of their mental and emotional needs during these challenging times. Now I'm going to turn it over to John Porter, who will discuss our ongoing preparations for the expected rise in COVID-19 cases in our community and in our hospitals. John?
Thank you, Tom. Our teams have really done remarkable work in the past few weeks to ensure those that need care in our communities will continue to have access to find it. It's important to understand that we have not yet seen the worst of the pandemic. We've been monitoring the predictions, and there is widespread agreement that Central Pennsylvania will see a significant increase in the number of COVID-19 cases in our community in the coming days and months. Be assured, we are thoroughly and thoughtfully preparing for what we know is coming and the strain it will put on our hospitals. As Central Pennsylvania's trusted healthcare partner, we're taking bold, coordinated action to prepare for the anticipated rise in patients requiring acute patient care. Our plan includes the following. First, as Roxana mentioned, we will be doubling the critical care capacity in each one of our communities. Second, although we have currently adequate supplies and equipment, we are also working to secure additional supplies from FEMA, state government, vendors, local businesses, and community partners. And third, we're tapping into the strength of our current and retired workforce, as well as our neighbors in the community, to reinforce our care team needs at our hospitals. To expand our critical care capacity, we are redeploying operating rooms and recovery bays for critical care areas. We're able to do this because we have already postponed all elective procedures and surgeries in anticipation of this. We are also temporarily redesigning WellSpan Surgery and Rehabilitation Hospital for non-COVID-19 acute inpatient care, allowing for more capacity at WellSpan York Hospital for COVID-19 patient care. Through these efforts, we are planning to add an estimated 160 critical care beds across our communities and 116 acute care beds at WellSpan Surgery and Rehab Hospital. And lastly, we are exploring collaborative efforts with government agencies, other healthcare providers, businesses, and organizations to provide additional space for overflow clinical care should the need arise. Regarding our medical supplies, we have implemented a multi-pronged approach in an effort to ensure our hospital care teams have the equipment and supplies they need for anticipated increases in care activity. With 8 hospitals and more than 200 care locations, we have the ability to coordinate quickly and redeploy equipment and supplies to where the need is greatest. As Roxana shared earlier, we are exploring innovative solutions to our medical supply needs in partnership with our communities. And we continue to work with state and federal government to help source PPE, ventilators, and other materials. Government leadership in this area will be essential if we see a sharp and fast rise in COVID-19 patients in our acute care settings. We also know that we're going to need more clinical staff to treat the expected influx of patients. We have already begun to redeploy physicians, nurses, and other staff to our hospitals where there are greatest needs. We're able to do this because we had intentionally reduced patient volume in our other service areas in anticipation of this. And we are reaching out to our non-clinical staff members to understand where we may have pockets of staff that had former medical experience so that we may redeploy them for patient care areas. And now I'll turn it back to Roxana for a few final comments.
Thanks, John. At WellSpan, we're doing exactly what our community expects of us during times of crisis. We're leading, and we're taking care of our neighbors. WellSpan will continue to be your loyal, trusted partner, working hard to deliver the safest, highest quality care to every patient. We're in this together as one community, united. And now Ryan Coyle from our PR and communications team will facilitate a brief question and answer session.
Hey, thank you so much, Roxana. Okay, let's open this up to a few of the questions that came through here, and we will address some of those questions as best that we can. So let's start off with WGAL's Meredith Jorgensen. Meredith sent in, and this one is for Roxana, what are the top priorities of the health system for WellSpan right now?
Our top priorities right now are the safety and well-being of our teams. We're working hard at that. And the second priority, I would say, is making sure that those who need care for COVID-19 treatment and testing can receive it.
Okay, thank you so much. Question number 2 comes from Sam Ruland at the York Daily Record. This is also a question for Roxana. She says, we are hearing that OSS, which has large facilities to work with, could partner with WellSpan and other surrounding networks to provide non-coronavirus care and space for patients. Can you speak to that?
Yes, we are collaborating with OSS. They've been good partners, and we have had several ongoing conversations with them.
Okay. All right, the next question is for John Porter. This is from Ted Check with York Daily Record. Ted wants to know, what has been the overall mood of staff at York Hospital or WellSpan York Hospital that you have seen, John?
Absolutely. Great question. I think the overall mood has been as positive as it can be in these circumstances. We have many programs at the hospital, as well as all of our organizations, to engage our employees and to focus on well-being. We also have our clinical team from Philhaven, a behavioral health provider that's able to help our employees as they go through the anxieties of providing care and knowing what's coming. Philhaven has the largest behavioral health footprint in South Central Pennsylvania, and they've been a real asset during this period. We also have had a lot of community support at not just York Hospital, but others. We have had community residents with signs, street art, etc., helping our team get through this. At Ephrata Hospital, we had a hunking party last week with residents in cars, and at Chambersburg, we had local churches identify with each one of the departments at Chambersburg Hospital and praying for their activity.
Thank you. This next question is from Jim Hale with the Gettysburg Times. Jim asks, has WellSpan, and this is for John, please, has WellSpan arranged for off-site beds in hotels or elsewhere so that COVID-19 coronavirus patients don't have to go home to their families?
Yes. We do have alternatives after people would need acute care for alternatives within the community in various areas. And each one of our communities, Gettysburg is one of them, but yes, we do have arrangements for those locations in each community, including Gettysburg.
Okay, thank you. The next question is from Logan Hollinger with the York Dispatch. This question is for Roxana. Roxana, he asks, are we at all concerned about nursing retention as far as working through this?
Yeah, I think nursing retention is something we're always concerned about. And as John just mentioned, we're providing a number of supports to all of our teams to ensure that they get what they need as we move through this crisis. So always a concern for us, and always working to ensure that we have the right strategies in place to keep our team safe and able to do their work.
Okay, I appreciate that. Thank you, Roxana. So I just want to remind everyone, if you're looking for the opportunity to ask questions, you can post them under the chat feature. So again, you would click on chat on the bottom of the screen, and it will open up Zoom chat on the right side of the screen. You can click under the to category, TO:. You can select my name, Ryan Coyle, and it will allow you to post your comments directly to me or questions that you may have, and we'll have them field. Just as a heads up, we will be posting this to our website here within hopefully the hour, depending upon the upload time, but we will post this to our website for those that are interested in viewing it. In addition to that, I know Jim Hale did ask a question from the Gettysburg Times as far as whether there will be written copies of the comments made. And that question, Jim, I can tell you, we will be posting and providing these comments. You can email me. It's the same email that I sent earlier, the initial introduction, that is rcoyle@wellspan.org. Okay, the next question coming in is from Joel Berg. Is WellSpan at all concerned about having adequate PPE and ventilator supplies given the appropriate shortage being seen in New York City? And Roxana, can you please answer that one?
We're always looking to ensure that we have the right supplies for the right kind of care at the right time. And so from the very beginning of the pandemic, we've been working with our supply chain and with local companies to ensure that we have those supplies. So we believe that as we all work together to flatten the curve, that those concerns will hopefully be more allayed than they are right now. So we're always looking at that.
Absolutely. All right. Well, I appreciate everyone's time during this event. I really appreciate you guys making the time. And it's been a unique experience for all of us to be doing this via video chat, but we realize it's probably the most appropriate way to do so right now as we all practice social distancing to limit the spread of COVID-19 and coronavirus as much as possible. So again, I want to thank you all for joining us. Again, we will be making this available on our website here, as well as social media platforms. There will also be a news release coming out here within the next few minutes that will highlight all of the details that our senior leaders just announced. So thank you again, everyone, and have a good rest of your day.